Are you feeling more tired than usual, constantly thirsty, or healing slower than before, and just blaming it on age? These could be early red flags that your blood sugar is out of balance, and you might not even realize it. Diabetes often develops quietly, with subtle signs your body whispers, not shouts. Let's uncover the 5 early warning signs of diabetes that most people miss before it's too late. Why this matters: more than 1 in 3 adults over 40 are pre-diabetic, and most have no idea. By the time clear symptoms show up, blood sugar levels may already be dangerously high. But here's the good news: if you catch the early signs, you can take action, and in many cases, reverse or prevent full-blown type 2 diabetes. That's why understanding these subtle symptoms could save your energy, your vision, your kidneys, and your life. Diabetes doesn't just affect your blood sugar. It slowly damages your heart, eyes, nerves, and brain if left unchecked. It can lead to blindness, kidney failure, amputation, and even stroke, but it rarely starts with dramatic symptoms. The earliest signs are easy to ignore. You might feel off, tired, or just a little more thirsty than usual. And for many people, those mild symptoms continue for years, until a doctor delivers a diagnosis they never saw coming. The risk increases after age 40, especially if you're overweight, have a family history, or lead a sedentary lifestyle. That's why awareness is your best defense. Even small changes like cutting back on sugar, walking daily, or managing stress can lower your risk dramatically. The earlier you act, the more likely you are to avoid medications, complications, or permanent organ damage. This isn't just about numbers, it's about protecting your quality of life for the years ahead. Let's walk through the top 5 warning signs your body may be giving you right now, before it's too late. 1. Constant fatigue. Even after rest, feeling wiped out by mid-morning or needing a nap after lunch. When blood sugar is too high, your cells can't absorb glucose properly, and you don't get the energy you need. Even after a full night's sleep, people with early blood sugar issues often feel drained, sluggish, and mentally foggy. This kind of tiredness is deep, not just physical, but also mental. And if you're over 40 and chalking it up to age or stress, it might actually be a blood sugar imbalance. Many people describe this fatigue as walking through mud, where even simple tasks feel exhausting. You may lose motivation to exercise, feel irritable for no reason, or have trouble focusing at work. This isn't laziness or burnout, it's your body struggling to fuel your brain and muscles. Without proper glucose absorption, your cells are literally starving for energy, despite eating enough. Over time, this leads to a vicious cycle of cravings, weight gain, and even depression. And here's the catch: your body may temporarily spike energy after eating sugary foods, but that crash that follows makes fatigue even worse. If your energy levels are unpredictable or always low, your blood sugar might be fluctuating more than you think. It's one of the most common and most ignored early warning signs of pre-diabetes and insulin resistance. Recognizing it now can help you take back control of your metabolism, energy, and overall health before it turns into something more serious. 2. Increased thirst and frequent urination. If you find yourself drinking more water than usual and constantly running to the bathroom, pay attention. High blood sugar pulls fluid from your tissues, which leads to dehydration and triggers thirst. Your kidneys try to flush out the excess sugar through urine, making you go more often, even at night. This cycle can leave you parched, tired, and even lightheaded. If you're waking up several times a night to pee, it's worth getting your blood sugar checked. It's not just annoying, it's your body in overdrive trying to protect itself. Frequent urination, especially at night, a condition known as nocturia, is one of the most common and earliest signs of diabetes. You might also notice that your mouth feels dry, your lips crack more easily, or that you can't go long without carrying a water bottle. Some people even develop electrolyte imbalances, leading to muscle cramps or headache. The problem worsens when sugary or caffeinated drinks are used to quench the thirst, which only adds more sugar to the bloodstream. Over time, this pattern strains your kidneys, leads to dehydration, and causes dangerous fluctuations in blood pressure. If this symptom continues for weeks or months, it's not just aging. It's your body waving a red flag. Getting your fasting blood sugar or HbA1c checked can help you catch the problem early and potentially reverse it with lifestyle changes before medication becomes necessary. 3. Blurry vision that comes and goes. Can't see clearly even with your glasses. High blood sugar can cause the lens of your eye to swell, changing your ability to focus. What's tricky is that this kind of vision change can come and go, so it's easy to ignore or blame on eye strain. If you notice frequent changes in your eyesight, dry eyes, or difficulty reading in low light, it might not be your age. It could be your glucose levels. Many people assume their glasses need updating, not realizing their blood sugar may be spiking and crashing throughout the day. These fluctuations affect fluid levels in your eyes, altering shape and pressure, which impacts vision. In early stages, the changes are reversible, but left unchecked, this can lead to permanent damage like diabetic retinopathy. That's when blood vessels in the retina begin to leak, causing blurred vision, floaters, and even vision loss. Some people also report seeing halos around lights at night or struggling to adjust from bright to dim lighting. You may feel like your eyes are constantly dry or tired despite getting enough sleep. High blood sugar affects every part of the eye, including the cornea, lens, and optic nerve. And if you're already wearing glasses or contacts, these changes can be subtle and easy to miss. The key is consistency. If your vision feels sharp one day and blurry the next, it's a red flag. Don't just assume it's screen time or getting older. Get a comprehensive eye exam and ask your doctor to check your blood sugar. 4. Slow healing cuts or frequent infections. Notice that small cuts take forever to heal, or that you're getting more skin infections, UTIs, or gum issues than usual. Elevated blood sugar can damage small blood vessels and weaken your immune system, both of which slow down your body's ability to repair. For men, this might show up as fungal infections under the arms or groin. For women, it could be recurring yeast infections. If your body's healing ability has changed, it's time to investigate your blood sugar. What many don't realize is that high glucose levels create the perfect environment for bacteria and fungi to grow. This means even minor injuries can become serious infections if not treated quickly. You might also notice more dental problems, like red, swollen gums or frequent mouth sores, because diabetes affects blood flow to the gums and increases inflammation. Frequent colds, sinus infections, or even slow healing bruises could also be signs your immune system isn't firing at full strength. And if you're using over-the-counter creams or antibiotics more than usual, your body may be telling you something deeper is wrong. In fact, delayed wound healing is often one of the first physical symptoms doctors look for when screening for diabetes. The danger is in delay. What starts as a minor scrape or rash can, in diabetics, turn into a serious infection, even one that requires hospitalization. If you've noticed your cuts, scratches, or skin conditions aren't healing like they used to, don't ignore it. Get your blood sugar checked and give your body the support it needs to recover properly. 5. Tingling or numbness in hands and feet. This is one of the most commonly missed signs. High blood sugar can damage nerves, especially in the extremities, causing a sensation of pins and needles, numbness, or burning in the hands, legs, or feet. At first, this may only happen at night or after sitting too long, but over time, it can become constant and, if ignored, may lead to permanent nerve damage. This condition is called diabetic neuropathy, and it often starts before a person even knows they're diabetic. You might feel like your feet are falling asleep more often, or like you're walking on cotton or sand, even on smooth floors. Some people report sharp, shooting pains or a creepy crawly feeling under the skin, especially at night. Others may feel nothing at all due to complete loss of sensation, which increases the risk of foot injuries, infections, and ulcers that go unnoticed. This nerve damage doesn't just affect comfort, it can also affect balance, walking, and even driving safely. If left untreated, it may spread upward from the feet to the legs and from the hands to the arms. What's worse, many people chalk it up to poor circulation or aging, when in reality it's a sign of glucose overload harming the nervous system. If you've been experiencing unexplained tingling, numbness, or burning in your extremities, especially with other symptoms like fatigue or excessive thirst, it's critical to get your blood sugar tested. What's happening in your body? When your body becomes resistant to insulin, the hormone that helps sugar enter your cells, glucose builds up in your bloodstream. Your pancreas works harder to produce more insulin, but over time it can't keep up. This leads to elevated blood sugar, inflammation, and damage to blood vessels, organs, and nerves. Catching insulin resistance early gives you the chance to intervene with diet, exercise, weight management, and stress reduction. In many cases, prediabetes can be reversed naturally, but only if you act early. Insulin resistance usually starts quietly. Your body needs more and more insulin to get the same job done, which stresses the pancreas and throws off your entire metabolic system. As blood sugar rises, inflammation increases, setting the stage for heart disease, liver dysfunction, and even cognitive decline. Over time, this can lead to type 2 diabetes, where your body can no longer control sugar levels on its own. The scary part: many people don't realize this process is happening for years. You might feel hungry even after meals, gain belly fat more easily, or feel exhausted despite eating. These are subtle signs that your body isn't processing glucose properly. But here's the good news: insulin resistance is not a life sentence. With the right changes, like cutting refined carbs, walking 30 minutes a day, managing sleep and stress, your cells can become sensitive to insulin again. Call to action. Let's quickly recap the 5 early warning signs of diabetes you might miss: chronic fatigue, excess thirst, and urination; blurry or shifting vision; slow healing and frequent infections; tingling or numbness in the hands or feet. If you recognize even 2 or 3 of these symptoms, don't wait. Get your blood sugar tested. The earlier you know, the more power you have to prevent serious damage. Even small steps, like walking daily, cutting sugar, and eating more fiber, can make a big difference. Your future energy, focus, and long-term health depend on the actions you take today. Don't let silent symptoms turn into serious disease. Like this video if you found it helpful. Subscribe to Purely Health for more expert-backed health tips every week, and let us know in the comments. Which symptom have you noticed, and what steps are you taking to stay in control?